let's just. Okay, it'll just look a little filtered and
You look gorge.
Oh.
You look absolutely gorge.
Oh, yes. Well, I'm gonna do my best. Okay, so you have your PowerPoint ready?
I do.
Great. And I saved yours on the one that you sent to me, and we'll just put that up after tonight's meeting and on the website so that anyone who didn't get to come will be able to check it out and see all the good stuff.
Sounds good.
Yeah. So,
Everybody's in,
yes.
Rachel.
Everybody's in? Okay. I will go ahead and get started because it's just that time. Hello, everybody. Welcome to the 34th Legislative District Democrats, part of our speaker series. And we are very lucky to have one of the healthcare gurus of our fair district. Jen Nye is going to be presenting from Hull, Washington, and this is a learning opportunity. So if you're wondering if you're in the right place, you are in the right place. So again, I'm going to pass this over to Jen and Jen Nye of Hull, Washington. Thank you for coming, and I'm going to go ahead and pass it right to you.
Okay, awesome. Thank you so much for the intro, Rachel, and thanks a lot for all the work that goes into putting on these programs. I appreciate everybody showing up tonight to talk about this very important topic, universal health care. When Rachel and I first scheduled this meeting, it was from a completely different context, but I feel really fortunate to be able to represent this organization tonight, let you know about the work that we do, hopefully garner your support, and let you know how you can help if you're interested. So I'm just gonna go ahead and share. That's okay.
Yes.
Is everybody able to see this all right? I'm having trouble viewing it. It's kind of like a narrow strip. Is it working for other people?
Sorry, who is having trouble?
This is Roxanne.
Oh, hi,
It's just a
Roxanne.
little strip.
Is it?
Yeah,
is it
there's
your
something
view?
wrong.
Can you
Can't
change
get
the
it to
view
go to
or?
screen.
You can go to the right-hand side of the picture and move the line to expand the PowerPoint.
It's just
On
one
your-
little strip still. So I see the strip of the left or the strip of the right of the PowerPoint, but not the whole thing. Is that just me? I'm going to exit and re-enter perhaps.
Do you see view options, Roxanne? Maybe it's.
Yes. Yeah, that's not helping at all.
And that's not, okay.
No. I'm familiar with Zoom and I've tried everything I can and I can't get this to get bigger. Wait a minute. Okay, I'm just dragging the left and the right. Got it.
Is
Oh,
that
good.
is that
Yay!
working? Yay.
Yep, I got it.
Yes.
Thank you. Sorry.
No
That's okay.
worries.
That's okay.
Thank you. Thanks, Jen, for a pause there. Go ahead.
So I thought that I'd start this presentation with just a campaign update. So for anybody that's already familiar with Hull, Washington, you may have known that we filed an initiative to the Secretary of State to get universal health care on the ballot. Here, let me just move to the next slide here. So we filed in April. We started collecting signatures in earnest in late June, and we were consistently checking the COVID cases, and it just became apparent that this was a very risky endeavor. And so we held an emergency board meeting on August 17th and made the official announcement on 8/19 that we were going to stop gathering signatures. It was a really heartbreaking decision, but we feel like as a healthcare campaign, it was the responsible call to make. We have a lot of volunteers that are retired. We have moms with unvaccinated kids, and our chair and our vice chair are both registered nurses, and they see the trauma of our crumbling system every day, and we just could not risk contributing to that. So one thing I just want to call out real quick on this slide is this number of signatures that were required. It does include the padding for the signatures that get thrown out in the validation process, but it's super high. And it's based on the last gubernatorial election. I think it's like 8% of it. And that last election was the Biden-Trump election, which had really high turnout. And what that meant was it increased the signatures that we had to get by like 100,000. So it was already like a really big uphill battle. And you couple that with the big public events that were automatically canceled, and they're usually the bread and butter of a signature gathering campaign. So, so this is giving us time to regroup and assess. So what I think I'm going to do is just talk about like who we are, what our strategy is for winning universal health care, and then we'll like actually talk about the legislation, the whole Washington trustless legislation, and then find out you know, how you can help if you're interested. So this organization is about 4 years old, 4 or 5 years old. It formed after the successful initiative campaign for 735, which was to overturn Citizens United. And the volunteers there just kind of looked at each other and just realized, hey, none of us have health care. And a lot of the volunteers at that time had been ignited by the Bernie Sanders campaign and were motivated to actually be involved, be active, and do something. And so that's how Whole Washington was formed. And it's Bernie Sanders' birthday, by the way. I highlight in here that we're a grassroots campaign. It really applies to us. We have 2 paid people on our staff, our accountant, and this summer we also hired a campaign director. And we really, really hope that we can keep him. Focused leadership like his is so necessary for success. But other than that, the entire operation is volunteer. So no one's making money. We're not building careers or even trying to make friends with politicians. Like, we just desperately need healthcare. This is a people-powered organization and a passion-powered organization. So to talk about our strategy, I think it's safe to say that every single person in Whole Washington's ultimate dream would be a national program. We all want Medicare for all. We all have friends and family in other states, and we all want to feel that support of a real healthcare system. But at the present time, we just don't see a viable path to success. And so we also have a state level approach. So we're not exclusive to either. We are fighting on all fronts, and we basically just say we're all storming the castle. We don't know who's going to get there first, but we support all of these efforts. So on a national level, obviously we support Sanders' bill and Pramila Jayapal's bill. And we also support the state-based Universal Health Care Act, which was introduced by Ro Khanna. And this picture here is from a direct action that we had earlier this year, where we protested outside of Derek Kilmer's office, demanding that he endorse the Medicare for All bill. And we have not been successful so far in getting that. So on the state level, we also have kind of a belt and suspenders approach, where we have bills in the state Senate. So we are trying the legislative path. And we also are very fortunate to have this tool of direct democracy, which is the initiative process. So that's where our focus is at the moment. So, and just so everyone knows, if we look at the Canada version of healthcare, they won it province by province. And so we're kind of looking to that vision and hoping that Washington could be the Saskatchewan and be the first state to actually do this. So I just wanted to kind of call out the pieces of legislation that we have sponsored and worked on in the past. So the very first initiative, which was 1600, it was filed in 2018. And it was based on the whole Washington Health Security Trust. So it didn't come out of nowhere. This was legislation that's been in the legislature for years and has not gotten out of committee. But what made it different was whole Washington did fundraising in order to hire an economist to do a financial analysis on the bill, so that we could have a legitimate funding package, so that we had that answer for how are you going to pay for it. And so we paid for an analysis by Dr. Gerald Friedman. He is a single payer expert. We've also recently asked for an update. It's kind of getting outdated. These numbers are kind of getting outdated, and we wanted fresh numbers, after the pandemic, to really see where we were. So that's also available. There's a small correction that we had to make in the second analysis, but once it's corrected, it'll be published, and we hope that you'll read it and help spread the word, because it really does shine a light on the fact that we can be saving money and getting so much more. So we did not get the required number of signatures for 1600 to make the ballot. On purely volunteer effort, we still got over 100,000 signatures. And every single one of those touch points were so important. We don't look at that as a loss. This is a social awareness program. It's face-to-face education. So the next step that we took was to have a bill in the Senate introduced. It was introduced by Bob Hasegawa, and it had two co-sponsors, Senator Hunt and Senator Karen Kaiser. The bill did not make it out of the Healthcare Committee, unfortunately. So the next step then was we made some adjustments to the legislation. And if anyone was familiar with the previous versions, we had a 1% income tax, and we got a lot of feedback on that there was concerns that it might be constitutionally challenged, that we could take a different approach. And so we did change the funding mechanism, and we'll talk about that in a little bit. But it also, it's a good opportunity to take in feedback and make improvements. So this version, the Senate Bill 5204, was introduced in January of 2021, again by Senator Hasegawa. And this time it doubled the number of co-sponsors, including our own Senator Wynn. We're very grateful for his support. So it'll automatically be reintroduced when the session reconvenes. I'm not positive when that is. I think it's January. I don't know if anybody knows, but considering the suspension of 1362, that will be a big focus of ours. The other thing I just want to call out, looking at these slides, as someone that has gathered signatures both for 1600 and for 1362. The public reception is just night and day. Like, I cannot tell you how grateful people are that we are doing this. I've been chased down. I've had joggers pass me. I've got my signature, my petition board up, and I have them following me because they want to sign. People are so much more aware of the possibilities of universal health care compared to 1600. The unfortunate piece is that a lot of people just don't know about us. So they're very positive, but the awareness is pretty low. So just real quick, I just wanted to kind of talk about the fact that there are a lot of healthcare bills, and they're usually about very specific populations or conditions, and we're sometimes asked if we support their bills. And considering that this is an all-volunteer organization, we made kind of a criteria list so that we know how we want to focus our time and our resources. And so we made this list of 5 criteria. So any bill that we support, everyone has to be able to enroll. There can't be any age limits or employment requirements. Everyone needs to be able to enroll. It has to be affordable. That word is, it's a little sketchy. It's usually associated with insurance, but what we're saying is that it has to absolutely remove any barrier to seeking care. We will only support bills that are nonprofit and publicly funded. It is our goal to make the for-profit industry obsolete. It has to have comprehensive benefits. So it has to cover anything that is considered essential to your health. So dental's included, vision's included, hearing aids included, reproductive health, absolutely included. And then finally is just, is it fully realized legislation? Can it be implemented? We have done a lot of studies. There are a lot of studies already out there that prove that we can save money and cover everyone. So we don't want to support further delays. We really want to begin the transformation. So let's talk about the Whole Washington Health Trust, what it is, who it covers, what it covers. So it would be the first statewide publicly funded, privately delivered, not-for-profit healthcare system in the United States. So instead of hundreds, maybe thousands of insurance plans and multiple government programs, there would be one government-backed guaranteed trust that would pay the healthcare expenses of all of the Washington state residents. And this bill was written by citizens for citizens, with the ultimate goal to provide cradle to grave coverage for everyone, delivered to everybody. So as far as who is covered and what's considered a resident, we kind of based it off of the definition that's in the HCA. There's a residency flow chart, but to be rest assured that unemployed people are covered, people without houses are covered. If you are traveling out of state temporarily, you are covered, and those that are here for a job are covered. So what does it cover? Like I say, we are looking at this holistically. We don't want to deal with separate dental plans. So this would cover inpatient, outpatient, Emergency services, this would take care of those $7,000 life flight bills that are occurring in a lot of our rural communities these days. It covers vision, dental, mental health, reproductive care, and a big call out here, prescription drugs. So all generics would be covered. And there is a cap, a limit that's actually written in the bill that says that no adult would pay more than $250 a year for any drugs that weren't generic and covered. So that includes insulin, it includes everything. So I think I skipped ahead here. How do we pay for it? So this is traditionally the most asked question. And the thing that we really like to emphasize before we even get into the funding mechanisms are the costs that go away. So it's important to remember that you're not paying these taxes in addition to what you're paying now for insurance. This is in replace of. So co-pays go away, deductibles go away, post-procedure bills go away, your premiums to your insurance company, they all go away. And what is replaced are these consistent taxes that are based on your ability to pay and help with the fact that we have one of the most regressive tax codes in the nation. So just briefly, you're looking at an employer contribution of 8.5%. There's also an exemption. I don't want to get too much into the weeds with this. There's a lot of detail that is available on our website that kind of breaks these down and gives more details to them. There's a payroll deduction that your employer could cover. They could cover all of it. There is a capital gains tax of 8.5%. It would not apply to retirement. It would not apply to home sales or farm sales. And then there's also a monthly premium. And I know that this particular funding mechanism can sound confusing and even worrisome, but I personally find it to be almost a comfort, because it's written in the bill that premium needs to be reviewed every single year to be the lowest it can be, with the intention of it going away. And it can never be more than $200 a month. So I feel like while that $200 may set off a flag of being expensive, what that really is the absolute upper ceiling. And the other thing is that we've taken this bill both to the Department of Revenue and the Employment Securities Department to ensure that it's implementable. We've really done our homework. It is ready to go. The thing that I want to kind of focus on as far as these funding mechanisms go is the employer contribution. It is the primary source of funding for this. So we're talking about like 70% of the funding would still come from employers. The thing is that they would be paying a lot less, and they would be relieved of a lot of the administrative burden. So most employers can pay like 15%, 10 to 15% of their payroll, up to 30% of their payroll. So employers in our state could save up to $600 million annually. And the thing is this means that their costs remain consistent year over year. They don't have to adjust their budgets every year when their premiums go up. And then they don't have to hire brokers to shop for plans. They don't have to pay into their employees' HSAs. There's no open enrollment. There's none of that resource work. And another huge perk is there's no eligibility tracking between part-time and full-time. All of their employees would have Cadillac insurance, and healthy employees are happy and productive employees. So this is a big, big boon for businesses. But what I really wanted to kind of call out here, besides the economic benefit of moving to a universal healthcare system, our current system has verifiably racist outcomes, and we have to do something about this. This is absolutely indefensible. So what you're looking at here is from the Washington State Department of Health website. I believe it's from, I think it's even from August. And the important column here is this last column. This is the rate of death per 100,000. And if you take a look at this, what it's saying is that Blacks have twice as high a death rate as white populations. The Hispanic population, 3 times. Pacific Islanders, 6 times. Like, this is absolutely indefensible. So I include this picture. This is our previous campaign director who stepped down to have a baby. But he just really wanted to emphasize that this bill provides quality, comprehensive healthcare to everybody, regardless of race. And there's a lot of generational damage to our vulnerable communities that we have to address. But this is the foundation. This is absolutely the foundation. This is the way that we say Black Lives Matter, is by providing comprehensive, quality healthcare to everybody. So what I want to talk about now is just what can we do to get there? What are some options that you can do to involve yourself? So like tonight, you can go to your organizations and get endorsements or resolutions passed in favor. So again, we want to focus at all levels. So going to your city government, like I believe, I think Aberdeen has passed a city resolution in favor of the whole Washington Trust. Possibly Port Townsend is also looking to do something like that. We also need people to write letters to the editor. This is how you spread the word, and it's free. And we need to talk to our families, friends, and our co-workers about this. We need to be intentional. We have to organize our local circles. And I feel like West Seattle and Vashon could be extremely instrumental hubs of activism, like with the ferries, with the West Seattle Farmers Market. I feel like we could have a real consistent presence here and really make a dent in getting the word out. We also obviously need donations. This is, we run on low dollar donations. We don't have a sugar daddy or a sugar mama at the moment, not that we're not looking. But if anybody is interested in volunteering, this is a really critical stage, because this is where we build our ground game. This is where we get the organizations in support of us, even before the legislative session and before we would run another initiative campaign. So we have, it's not it's not confirmed that we're going to run another one immediately. It really will depend on COVID. And we have like a no-go list to verify whether we will file or not, but we need to be ready to go when we do. So I think that's really what I had. If we want to open up for questions.
Jen,
Do we have time?
Sure, we have a few minutes. Jen, I have a question from our audience, and so I wanted to just read it to you and have you respond. What are the sort of the situation with long-term health care? How would that fit into this law, this bill?
Yeah, I think that's a really good question, and it's something that might just have to be worked through in the amendment process. Like that, the long-term health care tax did pass. And what the whole Washington bill is saying is that long-term care wouldn't be covered right away. There would still, so I don't feel like it's necessarily already written into the legislation how it would work with what has been passed. So I probably could take that back and try and get a better, clearer answer for you. Happy to.
Yeah, and also if Elizabeth, if you are interested to stay in touch, our programs hub page on our 34th website, we're going to put all the contact information for Jen and Whole Washington, so that you should feel free to visit our website and go to the programs hub page, and you can get all the contact information. You can contact Jen or Whole Washington directly as we move forward with this bill, and please feel free to do that. I have another question. Who will manage this program at the state level?
That's a good question. There is a board. There's a Whole Washington board, and the makeup is actually written into the bill. But I think what's even more important is that there are 3 separate committees to kind of ensure that everyone is represented. There is a committee that represents us as citizens. There is a committee that represents providers, so they can make sure that they get paid adequately for the vital work that they do. And then there's also a committee that oversees the financial health of the trust and to make sure that it's solvent. Does that answer the question?
Yes, well,
Yes, it does.
it does. Okay, Roxanne, great. We also have a question about Medicare. If this law passes, does that mean that Medicare will become obsolete, or how would that work in together going forward?
So there's an entire page on the website about Medicare and how does it affect me if I'm on it. So essentially you can stay exactly where you are, or you can choose to enroll in the trust. And actually, let me, I can even put this page in the chat if that's okay.
Please. Any information that our members can draw from is helpful, Jen. So yeah, go for it.
Let me try and find the chat. I have a kind of limited view also, but just to summarize, just to kind of summarize really quick. Essentially what you would be doing if you enrolled is you would be selecting the Whole Washington Health Trust as a Medicare Advantage plan. And so that would cover your vision, your dental, your hearing aids. And if your household earns less than 200% of the federal poverty level, any kind of monthly premium would be reimbursed. So like I say, there is a really specific and dedicated page to it, and I will add it in the chat right now. But in short, it's much better than being on Medicare.
I've got another question, Jen, from Nick. Nick, do you want to unmute and just ask, or did you have a question?
Yes, I do. Jen, great presentation. I was just wondering about that employer contribution. How does that work for employers?
Like, how is it collected? How?
And are they would they be required to do that? Washington employers. I'm talking about the large ones that
The
employ
ERISA,
a lot of people.
ERISA plan.
Yes.
Is that what you were
yeah.
referring to?
Yeah, yeah.
Yeah, that's also another extremely complicated. But the gist of it is, if a company has an ERISA covered plan, they can, as long as they are providing 8.5% of their payroll toward their healthcare, they don't have to enroll in, they don't have to participate in the trust. However, once we reach a threshold of 51% of residents enrolled, then those companies do have to either provide 8.5% into the trust or prove that they provide that, and the employee security department would essentially give them credit for it.
Okay.
And I know it sounds complicated, but the great thing about this is if this was ever challenged, it would go to the Ninth Circuit Court where this solution was originated. So it's already precedence in that particular court. So we feel safe that it wouldn't be, that it would not, that it would pass a challenge, if that makes sense. But I can also, like I say, put in the chat more detail about how ERISA companies would deal with this. There you go, Nick. Served up to you.
And I also have a question for you. Go ahead, Chris. Do you have a question?
I do, thank you. Two things. When you, and thank you for the presentation. When you made that statement about families, signing up and they will be reimbursed if they fall at a certain level above, or I think it's below the poverty level. I'm concerned about reimbursing if families can't afford to offer that payment
To pay it
upfront.
upfront.
Yeah, and as good as the Obamacare was, the most difficult part was helping patients and families navigate the online sign-up portion, which was very complex, even for the Apple Washington plan. How complicated will this one be in terms of getting individuals and families signed up? I mean, it was even crazy in terms of what your password could and could not be in terms of characters. So just thinking about the complexity of signing up individuals and families who have a digital divide or just not tech savvy, and the issue behind how will families pay up front on reimbursement if they have trouble in the first place?
I mean, as far as the reimbursement, I reread that little section, and the section just says like you wouldn't pay a premium. So I might have just misspoke about saying the word reimbursement.
Okay.
It's very possible that it wouldn't be billed in the first place. So, but as far as like the rollout, like I am with you, like there's the making sure that it's a simple process and that we can reach everybody will be huge. But I also feel like this is going to be a difference of night and day as far as complexity goes. Like going on to the exchange, it should be nothing like that. You know, we're not going to be choosing between high deductible and low premium, like those things won't even exist. So it's basically just proving that you're a resident or that you're here for a job. And so it really should be the lowest possible bar to make sure that you get care. And another part that's in the legislation is just having community clinics where anyone could go in and get care, no questions asked. Like that's also part of the plan. It's just a wildly different world when health is the goal and profits and money isn't the goal.
Thank you.
Jen, we have some other questions, and I just am being very cognizant of the time because we are at 7:15. What I would
I can
like
copy them and respond, like, could I do written responses?
that is certainly just fine. What I was going to suggest that anyone who was not able to have their question asked and answered, that they could contact you.
Sure.
Can you, Jen, put your contact information one more time into the chat just so people can
Yeah.
see it? Because I
It's
really
easy.
great.
Jen at wholewashington.org. Shoot
And
me an
just put attention to you, and they can write to you and you will get it. Oh, there it is, Jen at, okay.
super easy.
That sounds great. I apologize to anybody who had a question that we didn't have time to get to it tonight. I know that there are lots of questions, and it is such an unusual, it's unusual. I mean, it's funny, a lot of the questions are still talking about how much would it cost for this? And literally this requires our brains to completely come at this whole thing from a totally different way, so that we're not talking about how much things cost. We're not talking about, I appreciate what you said about that. Health is the priority rather than profits and money. And I think that is something that it's a long time coming. This country is the only one of all 37 industrialized nations that does not have universal health care. And it seems like we all should really want to at least do something, call to action to do something to make sure that we could move to this kind of health care. I think that's just, it's necessary at this point, especially in light of COVID.
Definitely.
So anyway, thank you again, Jen. And I just wanted to, I want to let everybody know that we are going to be looking at a resolution in support of the whole Washington. So that's one of the reasons why it's great that everyone could be here, so that we can be informed when that resolution comes up tonight. And we're going to be considering that tonight. So thanks again, everybody. Let's give big hands, big waves to Jen Nye. Thank you so much, Jen, for a wonderful.
Thank you, Rachel.
Yeah, thank you.
Thanks
And
for the
again,
opportunity.
and anybody, please grab Jen's contact info in the chat and feel free to reach out to her personally. She'll be happy to chat with you. Okay, everyone. I think we're going to move over to the meeting. Jen, you are more than welcome to stay and join us for the meeting. I would like to just welcome you to our meeting. This is the September meeting of the 34th District Democrats. I'm now calling the meeting to order. I just want to let you know that Carla is, she just had surgery yesterday and she's okay, but she's just, we're giving her this extra time to just take care of herself and get better. She's on the mend already and we're sending her all the best. So anyway, you'll see me tonight. For those of you who are just joining us, I just want to let you know that we did just finish this very informative mini program about Whole Washington, universal health care for Washington State. And even though the signature gathering effort was stunted by COVID concerns, we just want to give members information so that they understand the initiative when it comes back to life. And it's a when, not an if. And we'll have the recording of this available on our YouTube channel later in the week. And we'll also have it up on Facebook as well. Before we get started, I just want to acknowledge on behalf of the 34th LD Democrats that the land on which we stand today is the traditional home of the Coast Salish and Duwamish people, the traditional home of all tribes and bands within the Suquamish, Tulalip, Snoqualmie, and Muckleshoot nations. Without them, we would not have access to this gathering and to this dialogue. I ask that we take this opportunity to thank the original caretakers of this land on which we live and work, who are still here. And now I want to take a moment to recognize the events of the past few weeks. If for nothing else, to inspire you to take action, to help you make it a priority to do something to support our organization, our candidates, our democracy. While we were all delighted to wave goodbye to our former president earlier this year, the stain of his 4 years is still lingering. Texas has now passed the strongest anti-abortion law in the country, banning all abortions after 6 weeks, when many women don't even know that they are pregnant. And what's worse, Senate Bill 8 creates a system of legalized harassment that literally places a $10,000 bounty on anyone who supports a woman trying to exercise her basic right to control her body and make her own decisions about her reproductive care. While horrific for women in Texas, it shows us how important our work is. And we must continue to work to share the values of the Democratic Party and elect Democrats of all types. We will talk later tonight about this cycle, but please don't forget that next year we are running up to the midterms, and maintaining control of the legislature is hypercritical because this Republican US Supreme Court has shown that they will let the GOP state legislatures do whatever they choose. It's critical, folks. We need you now. So please, I hope that you will join us in the fight. We're also approaching September 11th, and we again remember all the lives that we lost 20 years ago. It's been 20 years, can you believe that? Just a few days shy of 20 years marked the end of the war in a chaotic removal of the last troops out of Afghanistan. And as we watch the country crumble again, we shift our focus to the refugees who have landed here and across the US. And later on in this evening, we will hear about this influx of families, women, children, torn from their native land, and now here with hopes for safety and for a new life. So please stick around for that if you can. And now, let's get going. We are going to start with VIP acknowledgements. with a little twist tonight. First, I would like to introduce Kate Baumgartner. Kate, I think I saw you come in. So, hey, there's Kate. She's the political director for Senator Patty Murray. She's going to give us some updates. We really appreciate hearing from you, Kate. Thank you. And I'm going to hand the mic to you.
Great. Well, thanks so much, Rachel. And hi, everyone. Certainly sending healing wishes Carla's way as well. Wanted to start off by just making sure to introduce myself. I know I've met some of you previously, but to those of you who I haven't, I'm Kate. I'm Senator Murray's political director. Really excited to be working with the 34th this cycle. Just wanted to make sure you all know that I'm a resource for anything when it comes to Senator Murray's campaign or the senator's political presence. I'll be sure to leave my email in the chat after I finish. And then I'll just go ahead and give a quick update from what the senator's been working on recently. August was certainly a very busy month in Washington, D.C., and the start of September has proved quite busy in Washington State as well. So certainly, I know many of you followed the infrastructure package that passed the Senate in mid-August, and it included some really important funding for Washington State priorities that the senator was a strong advocate for. The typical things that we think of when it comes to infrastructure, like roads and bridges and public transit projects that will be funded across the state. But additionally, the bill takes really important steps on rural broadband, which we know we really need in rural parts of the state. And then Chris, I know you mentioned the digital divide just a couple moments ago. Senator Murray for several Congresses now has been working on her Digital Equity Act to provide additional funding and programmatic support to close the digital divide. And that bill was included in the infrastructure language as well, which is really encouraging to see. Also, the bill, of course, takes really important critical first steps on delivering for climate action, carves out billions of dollars for clean energy transmission, including new funding for electric vehicles. And within that, Senator Murray's clean school bus bill, which will help school bus fleets transition from diesel fuel to the electric grid, something that's, of course, especially topical as folks around the 34th go send their kiddos back to school last week and this week. And then additional funding for electric ferries as well, which of course is really relevant to the district. Billions of new dollars for climate resilience, salmon recovery, and then something that's on a lot of our minds this time of year as well as billions of new dollars in wildfire funding, wildfire fighting funding additionally. So I am certainly excited. I know the senator is certainly excited to see that bill pass the Senate. It's working its way through the House now, and I believe they've set a 4-week deadline to get that done. But the attention really now turns to those things beyond physical infrastructure, but that are critically important to deliver for working families and workers across Washington State in the budget resolution, budget reconciliation package. So the Senate went on to adopt the budget resolution, which is essentially the marching orders for all the Democrats to go back to their committees and really start to hammer out the details of the final language that will be in the Senate budget package. Senator Murray, as the chair of the Health, Education, Labor, Pensions Committee, is really focused on that work and will be leading on a couple of the really critical efforts. And I want to highlight a couple items within that budget reconciliation package that she's really fighting for and has been fighting for throughout her entire career. And it's really encouraging to see some momentum on them when it comes to this package. So first and foremost, universal paid leave. That's a program she's fought for since the beginning of her career. It's the first speech she ever gave on the Senate floor, and she's really working to get that language included in the package. Additionally, as a former preschool teacher, she's a longtime advocate for childcare and early learning support, and this bill would include a universal pre-K program as well as a national childcare program. Some additional funding for workforce training is really critical and something that she's pushing hard for, as well as an effort to make community college free to all Americans. A path to citizenship is something that the senator is a really strong advocate for, and there's a concentrated Democratic effort to include in the budget package, as well as additional landmark investments in climate action, knowing that that investment that was made in the infrastructure package is an important first step, but there's a lot of critical other ongoing underlying needs. And then funding for additional affordable housing is something that she's really focused on as well. So a lot lies ahead to hammer out the final bill as the Senate goes back into session this fall, but getting the resolution passed in August was a really encouraging step for momentum, and it's something that the senator remains laser focused on as folks return to Washington, D.C. Certainly in the meantime, she's been hard at work here in the state, having conversations with folks all over about what the package would do and what it would mean to communities, whether that's talking at Skagit Valley College about the importance of community college, or with childcare centers up in Whatcom County about what's available to them. So lots of really good work happening, and know that that effort continues. Of course, there are a lot of other urgent needs still facing the Senate. Senator Murray is really committed to fighting for voting rights. The House actually passed the John Lewis Voting Rights Act at the end of August, and the senator used that bill's passage as an opportunity to remind her caucus and the Senate that the clock is ticking on passing voting rights protections. She's a strong advocate for using every legislative tool available to get those packages or those protections signed into law, including an exemption to the filibuster, something that she's going to continue to be really vocal and advocating for as it turns to fall as well. And then Rachel, your words really hit home on just how difficult these past couple weeks have been. The senator is a leading advocate on reproductive freedom and fighting for protections for women's health. That continues to be the case as we face this draconian Texas law. She was really clear in her support for the Supreme Court granting an injunction in that case, but it's also been incredibly vocal that it is well past time for the Senate to act to codify Roe into law. And as an original sponsor of the Women's Reproductive Health Protection Act, that's something that she's been fighting for many Congresses as well. So, of course, Afghanistan certainly on her mind as well. The senator is supportive of all diplomatic avenues to continue to evacuate allies and American citizens who chose to stay in the country from Afghanistan, and as a senior member of the Veterans Committee is also really focused on making sure that veterans, and certainly specifically veterans of the Afghanistan war, have the resources that they need to navigate this difficult time. So I'll leave it there. I'll certainly make sure my email's in the chat. Really excited to be partnering with all of you this cycle, and just thanks so much for all of your work and all that you all are doing. I really appreciate it.
Thank you, Kate. I see that some of our members have some questions. However, what I would like to recommend, since we've got a full agenda, I would like to recommend, Kate has now put her info into the chat. Please take that contact info and feel free to contact her outside of the meeting or after the meeting's over, because we want to make sure that everyone who's on the agenda gets to do their thing. So thanks again for coming, Kate. I really appreciate that. We all do, and it's great to hear what Patty Murray, our senator, is doing and all the great things that she's accomplishing. So thank you again for being with us.
Thanks so much. And if I could just clarify one thing quickly, because I see the question in the chat about the Build Back Better legislation. That is the budget reconciliation process. Like, there are terms that can be used interchangeably. So just want to make that clear. But yeah, thank you so much, Rachel. Really happy to be here and to stay in touch. Thanks so much.
Yes, you bet. You bet. Okay, continuing with our VIPs who have joined us this evening, we have Seattle City Council member Teresa Mosqueda. Would you like to say a few words tonight?
Hey, everybody. I just wanted to pop in and say thank you. I'm really looking forward to seeing you in a few weeks when we get out the vote for the upcoming general election. We are incredibly proud of the support that we received in the primary election. 60% of the vote. It was a really strong showing, but we can't take anything for granted. And what's at stake is much of what was discussed from the federal level to the local level, fighting for progressive revenue, expanding healthcare access for everyone, and making sure that workers, especially women and workers with families, have the support they need in the post-pandemic recovery. All of that's at stake. So I just want to thank you as early endorsers in this race and my previous election. And that's my little one pounding her utensil on the table, but just wanted to pop in and listen in and say hello and thank you once again. And I really look forward to seeing you in the next few weeks.
Thank you, Councilmember Mosqueda. We also have King County Executive Dow Constantine. Executive Constantine, would you like to say a few words to us tonight?
Yes, thank you for having me. And I'm sorry the light is fading already here at 7:30 in the evening. But I am grateful for the opportunity to just share a couple updates with you. First off, I was able to meet up with Senator Murray last week to talk about the infrastructure bill and the exciting opportunities for our region. Some of the impacts on King County are, for example, the advancing our work on electrifying the entire Metro bus system. We're going to be proposing to move that forward from 2040 to 2035 now for completion of that project. But also, the big issue of this week is vaccine verification, and we are busy right now reaching out to community-based organizations, business groups, labor groups to ask about the right way in which to set up vaccine verification for public gatherings. Right. So we've been working with our sports teams, working with hundreds of restaurants that are already requiring vaccine verification so that we are able to make sure that public gatherings can continue, that we don't have to go back to reduced capacity or closing businesses, and that we're ultimately able to turn the tide on this upsurge in the Delta variant, because right now we're seeing our hospitals fill up in a dangerous way, and there's no reason for that in a community that has among the highest vaccination rates in the country. Afghan refugees are on the agenda today, and I want to let you know that King County has already offered at least one of our hotels that we've purchased to ultimately rehouse the homeless for an interim housing site. If there are any refugees who are not able to secure housing immediately, that will be made available along with all other county services, because it is the policy of my administration and of this county to provide our services regardless of immigration status, and that has always been the case. Finally, had a very successful primary election. I want to thank 34th District once again. We won in every legislative district, all 17 of them across the county by substantial margins. And yet we are out ringing doorbells every single day. I was out this weekend in the 43rd and in the 34th, and we're always looking for volunteers. If you'd like to volunteer, get a little exercise this fall, please email Natalie@dowconstantine.com. We'd love to see you. Thanks to everybody in the 34th.
Thank you, Executive Constantine. We also have King County Conservation District Supervisor Chris Porter. Would you like to speak a few words to us this evening? Do we have Chris Porter here? Oh, there we go. Hang on. I think he's on his way. Chris, this is a fast one, but if you'd like to speak now, the mic is yours. Chris, you're on mute. Would you like to speak, say a few words?
Yeah, thank you, Rachel. Yes, just remembering as we enter fall and we think about conservation in the environment, if you have yards, leave the leaves on the ground because they help enrich the soil, bring the bugs that feed the birds and butterflies and other insects, which are all on the decline. So any and everything we can do to increase that population helps us, because remember, 1 of every 3 bites of food we eat comes from pollinators, and we cannot live without them. Thank you.
Thank you, Supervisor Porter. Okay, do we have any other VIPs or candidates who would like to say a few words?
You have your school board director, District 6, Seattle Public Schools.
Okay, thanks, Leslie. We're going to actually be doing the endorsements later in the program tonight.
I appreciate that. Last I looked, I was elected citywide and I was a VIP. Is that not correct?
I'm sorry. I'm sorry. I thought we were looking for talking about the candidates, because you are also going to be introducing. I'm sorry. Go ahead, Leslie.
Not a problem. And I no mean disrespect to you. And I know how very, very difficult it is to run these meetings in person, let alone on Zoom. Folks, we have started school. We need you to slow down in school areas so that we don't hurt our 53,000 students. That means 20 miles an hour. It also means a big, big boy ticket that goes with that. And if you know anyone that is looking for a little of extra money and is good folk, let's get them driving school buses. We'll give you training and we'll give you health benefits. And we have an emergency right now for school bus drivers. Additionally, come February, we are looking at BTA 5, another levy, and we're working very, very hard on it. And my cell phone number for the school district is 206-475-1000. My email is leslie.harris@seattleschools.org. Most difficult work I've ever done in my life, and I'm old and cynical, and the most important. Thanks so much.
Leslie, would you be willing to put that information into the chat and folks can then see it if they weren't able to catch it when you gave it? That would be great. And they can copy and paste it too. So that would be really helpful.
And
Be my absolute pleasure. Thanks so much.
Thank you very much.
And Rachel, I'll get it all of that in the minutes, just like always.
Oh, thank you. Thank you so
Of
much.
course.
That's great. That's great, Sarah. Okay. Do we have any other VIPs, elected officials who would like to say a few words? Okay. The next thing that I wanted to talk about is the Speak Up survey question. You're going to see that in the chat here and just there it is. This month, we're going to try something a little different with hopes to get more input. So if you are able to take that survey now, just you can, again, copy and paste that link. We'd love to hear from you. We popped up this poll. It's about the summer meetings. And the question is, are we too busy in the summer to attend meetings and programs? And by we, I mean just y'all, the membership. It seems like we've had some really great programs that we've had very low attendance for. And that is okay if folks are doing stuff in the summer out there, being outdoors and spending time with family and friends. That is totally understandable. We'd like to hear from you if that is the case. We endorsed the mayor's race this summer. We declined to endorse a city council position 9 candidate and endorsed a Seattle city attorney with around 60 of our 551 members. And that is just, it's not okay with the chair and it's not okay with me either. So we're wondering, do we consider for next year skipping July and or August for our meetings? The June one is pretty important because of our endorsement meeting. That is extremely necessary, but we'd love to have your thoughts on that. So for those of you who would rather take the poll the traditional way, you can give more input that way. You can click the link that Sarah is posting now. As always, thank you for speaking up. We really do value your input. It helps us in shaping our meetings and shaping the way that we are running the organization. So we really do depend on your input. So now we're going to cover the Zoom tips. So let me just, we of course invested in a closed captioning service for accessibility. So if you are needing that, please do take advantage of that. We're happy to provide it for you. To initiate closed captioning, go ahead and click live transcription in the bottom menu. It may be elsewhere based on your device type. However, you should find something that looks like live transcription and consult. There is a, we've got a link here. Sarah, the CC instructions, can you put that in the chat in case we need that? Here we go. So Sarah's got some information. There we go. See it in the chat. If you need to access the closed captioning, please use that link that Sarah just posted in the chat. Okay, so this is for muting. Oops, sorry, everybody. Please keep yourself on mute unless recognized by me this evening. And when you are muted, the microphone will have a strike through, that little red line through that you see. So you will know if you're muted or not. If you are only on a phone, you can use the mute button on your phone to get the same result. This is the raise your hand option. You will use the raise your hand feature to ask to be recognized by the chair, by me this evening. The location of the raise hand may be different based on your platform or your device, but you can, you may need to use the dots menu in the participants panel, and that will show you the raise hand capability that with the icon, the blue hand. Let me just move to chat real quick. You may send a private note to the hosts and co-hosts only. Note the drop down where you choose who to chat with. Please do not use the chat to speak. Oh, this is important. If you have something to say for or against a candidate, we are asking that you not use the chat feature to do that because according to our bylaws, we only have 2 speakers for and 2 speakers against. And if we see speaking for or against a candidate showing up in the chat, that's going to use those 2. So we want to make sure that if we have official speakers who have been asked by the candidates or somebody or the candidate themselves, we want to make sure that we reserve those 2 for and 2 against for them. Candidates may use the chat to share their website or contact information. So we'll be looking forward to that. And so this screen shows the meeting minutes from our August 11th meeting. And Carla sent these out to the members on Sunday evening. Are there any corrections to the minutes? Any corrections to the minutes? Last call. Hearing none, would someone unmute yourself and make a motion to approve the minutes?
I put my hand up. This is Ann.
Thank you, Ann. Are you making a motion to approve the August minutes? Okay, thank you. Ann Martin is making the motion. Do we have a second?
I will second. Bunny Hatcher.
Bunny, thank you. Bunny Hatcher makes the second.
Rachel?
And all those in favor, say aye. And unmute yourself. Unmute yourself.
Aye.
And all, any opposed, say nay. Okay, great.
Do you
So,
want
Rachel?
a motion
Yes.
to
Aye.
approve the agenda, Rachel?
sorry,
Did you want a motion to approve the agenda before we approve? the
Yes.
minutes?
oh, the agenda. Yes,
I'll move the agenda.
thank you,
That's
Anne.
it.
Thank you, Anne. And Bunny, did you want to second?
Well, I'll
Sure, I'll
second.
second.
Okay, so sorry, Sarah will have the same names for the approval of the agenda. Ann Martin makes the motion, Bunny Hatcher seconds. Okay, thank you for keeping me on track, everybody. All those in favor, say aye. Unmute yourselves and say aye.
Aye.
And all those
Aye.
opposed, say nay. Great. Okay, the agenda has been approved. And now we're going to let's see. Sorry, I've got a script and I've got okay, I did, before we move on to the approval of the minutes, I do need to just make a note here. There is for good of the order, there is a special there. And so please make note of that. We're going to take some time during the good of the order to allow a friend of Carla's who works with refugees to speak with us about the Afghanistan refugee situation. And one of you emailed about resources to possibly offer, and that gave Carla the idea to invite Beth Farmer tonight. Does anybody have an issue with that happening? We're still going to end on time. It's just that there's going to be a little tweak. So I just wanted to, and I'm realizing now that I should have said that before we approved the agenda. But if there is no objection,
I would like to have, could I make a quick statement? Would it be possible to have those additional things added after we vote on the resolutions?
They're already on the agenda.
Right, but I think if I understand correctly, you're proposing that the additional things be added before the vote on the resolutions.
That is not correct.
No,
Okay, thank you.
Oh, they're
I
at the
withdraw.
end.
wait, hold. Let me just clarify. That this special good of the order was already on here. I just wanted to clarify what that was when we approved it. And I did not, I should have done that before, but this is not going to change our vote on the resolution or anything that we're doing. Even the time will stay the same. So I just wanted to just make this note of what this word special on good of the order meant. So Julie, I apologize that I didn't do that before, but we will still vote on the resolution beforehand. So now we have approval of the minutes. This is the minutes, and there are 2 pages. So I will show you.
You've already got approvals on the minutes, Rachel.
We do.
We already approved them.
Okay, thank you. Thanks, everybody.
A bit out of order, but it was there.
Okay, thank you, everyone. Okay, so without further ado, I will now move to Julie. And Julie, this is a good segue since you just had the question, and here you are coming back with your report. This is our treasurer report. Julie will present the monthly treasurer's report. And this report was emailed to our members on Sunday. Julie, take it away.
Okay, this is our August treasurer's report. Our beginning balance was $35,944.17. Our income was $3,152.01. This included memberships, the refund of event menu rental, t-shirt sales, and a refund of campaign donations that were then turned around and paid back because they got confused. Okay. Excuse me. Our expenses were $10,535.24. These were the basic fees that we pay each month, and it included the $9,200 campaign donations and our picnic, which we'll probably talk about later. The ending balance was $28,560.94. And we've got 551 members, and we haven't had any change make sense things lately. So people need to take a look at that and do that. I know I've got a bunch of change piled up. Okay.
Great. Julie leading the way. So yes, for those of you who don't know what change makes sense is, it is an ongoing fundraising platform that we are introducing to the 34th LD Dems. It is based on a fundraising campaign that I created when I was a delegate for Obama in 2008. And it's literally based on giving change. So loose change, something you have in a little bowl by your keys before you walk out the door. It is any amount that you have that is money that you don't miss, because it's like change sitting in a bowl or something like that. The hope is that it makes giving to the 34th accessible for anybody, because there's no minimum or maximum what you can give. I mean, if you've got 67 cents, great, put it in the 34th pot. We're going to be doing this campaign all year, and you know, we those pennies add up, and so we just want to make sure that we're having access. Everyone has access. Everyone feels good about giving something, contributing to the 34th, and it really does help. It adds up more than you know. So that's what I will say about Change Makes Sense. We have an announcement. First off, it is with great disappointment that our planning committee and board have agreed that it's not prudent or responsible to have a large gathering at this time. And what that means is, I mean, even in Seattle, we're watching the reports of a surge in COVID, just as Executive Constantine mentioned, along with a lot of fear about the Delta variant and additional variants. And so with heavy hearts, we have made the tough decision on Wednesday that we should cancel the picnic. As we look out to December and our end of the year celebration, we will watch the King County Health Department guidance very closely, and we will always make our decisions based on what is safe and in the best interest of the membership. On a brighter note, we want to give a hearty congratulations to Washington Conservation Voters Legislator of the Year, our very own representative, Joe Fitzgibbon. Joe has been a tireless advocate for the environment, and on a personal note, he's also been very active in our Environment, Energy, and Land Use Caucus. So thank you, Joe, for all your great work. Keep it up, and congratulations. I'm not sure if you're here tonight, but congratulations to you. I am excited to report that we have, Carla and I have both been working on this. We've successfully convinced Highline School Board member Aaron Garcia to run for the King County Democrats Central Committee alternate officer. You may remember that we have had our alternate position vacant for some time. And so we now have Aaron is going to run for that position on our executive board. And Aaron, are you here tonight? If you're not here, so he's probably knocking on doors for his brother Ugo, and we will hold this election at our next meeting. So please plan to be there on October 13th so that we can go ahead and vote for Aaron as our new alternate for KCDCC. Of course, this is a traditional election, and we'll need to hear motions from the floor for other nominees as well. But we're looking forward to that election of our new alternate. As I mentioned earlier in the program, we will take a few minutes during our final agenda item to hear from Beth Farmer, Director of Refugee and Asylum Services for Lutheran Community Services Northwest. She will give us insight into what is going on with the Afghanistan refugee situation, so we hope you stick around for that. We have a new page on our website that lists many different ways that you can help, and Sarah will place that in the chat as well. There it is. Thank you, Sarah. Our next board meeting, mark your calendars. Our next board meeting is Wednesday, October 13th. Oh, our next board meeting is September 15th at 6:30. Anyone is welcome to join us there. And please let us, Carla or I, know if you would like the Zoom link for that. Now, our next membership meeting is going to be held on Wednesday, October 13th. And I'm working on a pre-meeting program about the key election topic, which is the homeless situation. The program will begin at 6 p.m. And one of our members, Stefan, I'm sorry if I did not pronounce that correctly, Stefan Thomas, will also be talking to us about criminal justice reform. And the link to register is being placed in the chat, and we'll have it up on the home page of the website tomorrow. Thanks, everybody. Hope you join us for that. We are pumped about the 34th t-shirts. I am trying to see if, let's see. We've got a picture. It's a graphic right there. Look at those wonderful t-shirts. They're active, they're exciting, they are provocative. So just in time for canvassing this fall, go ahead and order your 34th Dems Ignite Change t-shirt for just $25. There's going to be a link that's also in the chat, and it's on our homepage. These t-shirts are, as you can see, they're soft cotton, they don't shrink. And the graphic was done by a local artist. So we're trying to support artists in our LD and artists in general. So thanks, Sarah, for doing the wonderful graphic on that t-shirt. Okay. So here's, we're now moving to the endorsement process. This month, I think our endorsements will not be too complicated or too lengthy. Regardless, let me repeat some of the rules and process tips just to keep everyone on board so that everyone feels really good about voting tonight. The remainder of the 2021 endorsements, it's a simple voting process. To make a motion, just raise your Zoom hand to signal me and I will call on you. All motions to be heard first are to be heard first, and then we will have 2 speakers for and 2 speakers against. As I mentioned, you must be a member or a PCO of the 34th to make a motion or speak on behalf of a candidate. And candidates must all be declared Democrats. Okay, dun, 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 endorsements. So I'm wondering if Long Fan is here.
Rachel, you need to do the endorsement first before we go to Long.
Sorry. Okay, sorry about that. Sorry, I'm jumping ahead. Are there any motions tonight for endorsement? Please raise your Zoom hand. I see Leslie. Go ahead and unmute yourself, Leslie, and
Thank
make
you
an
so
endorsement.
much. I can't see what I look like, and it's probably not very pretty anyway. But I rise to endorse Brandon Kyle Hersey for the Seattle School Board.
Okay, Leslie Harris has motioned to endorse Brandon Kyle Hersey. Do I have a second?
I second.
Steve Butts has seconded. Great. Are there any other motions from the floor for Seattle School Board District 7? Any other motions from the floor for Seattle School Board District 7? Hearing none, the nominations are now closed. Leslie, would you like to speak to your motion, or you may yield all or part of your time to Director Kersey?
I will yield part of my time to my colleague, Brandon Kyle Hersey, who I love and adore and argue with on a very, very frequent basis, but do so with extraordinary respect. And I can tell the 34th District Legislative District, my home, that this gentleman is the real deal. And he cares about students. And as often as I disagree with him, we do so with the right issues in mind, our 53,000 students and our 12,000 staff. And I give the rest of my time to Mr. Hersey. Thank you.
Mr. Hersey, the floor is yours.
Can y'all hear me?
Yes.
Okay, fantastic. Thank you, Director Harris. It has been an absolute honor working with you. And just for those of you who might not know Leslie very well in the 34th, y'all are very well represented, though I think it is very difficult not to know Leslie Harris in the 34th District. I just wanted to say thank you so much for having me yet again. I am very excited to be sitting for your endorsement. I have worked alongside Senator Joe Nguyen and Leslie Harris for the past few years, and am just incredibly thrilled every time I get to speak with members of the 34th. I'm not gonna lie to you, we are facing one of the greatest challenges in our lifetime in terms of reopening our school buildings. I've had the pleasure of touring about 20 schools out of our 104 schools since the beginning of school this year. And what I gotta say is that folks are just excited to be back in buildings. But what we need to focus on is a strong recovery, not only right now, but as we head into the next couple of years for our district. And we cannot let COVID be our only concern. We still have much to do in the terms of Black student safety and the safety of all students in our district, as well as figuring out how can we make an adequate and pronounced shift to student-focused governance so that we can prepare our children for whatever comes next for them post-high school. I believe I'm the candidate to vote for in this race because not only have I served for 5 years as a second grade teacher in the Federal Way Public School District, but I am the son of a teacher, the grandson of a teacher, and have previously done policy work with the Obama administration and currently serve as vice president of the board, working very closely again with Director Harris and the rest of my colleagues to advance policy for children. So I humbly ask for your support, and I will turn it back over to you, Madam Chair. Thank you so much for your time.
Thank you very much, Director Hersey. And do we have anyone opposed to the endorsement of Brandon Hersey? Hearing none, I would
Madam
like.
Chair, I ask for acclamation. Thank you, Leslie Harris.
Thank you,
PCO
Leslie.
1247.
Great. I would like to suggest that we vote using the raised hands. Or do we just vote, say yes by acclamation? Since we have no objections, I would be happy to entertain a vote by acclamation.
I think
Thank
we
you,
just
Madam
all
Chair.
say aye or nay.
Yeah.
Yes. All those in favor, we'll go ahead and do a voice vote. All those in favor for endorsing Brandon Kyle Hersey, say aye.
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 And all those opposed, say nay. All right, congratulations, Brandon. You have gotten a unanimous endorsement. Best of luck with your campaign. We're pulling for you.
Thank you so much. I certainly do appreciate it. Y'all have a wonderful rest of your evening and take care. Make sure,
bet.
please wash your hands.
Yes, thank you. Thank you very much, Director Hersey. Okay. Are there any other motions of endorsement this evening? Any other motions for other candidates? Okay. We're going to go ahead and move on now. this is where we've got, I'm going to change gears a little bit. We're going to put our spotlight on the Highline Education Levy renewal. Long Fawn, are you with us? Please unmute if you are. I am not seeing. Carla, do you have any information about the situation with Long Fawn?
He was on earlier. You don't see
He
him?
was, and he's not here now, and I'm not sure what. All right, should we maybe just put this on hold, and I will move
Yes.
ahead, and if he joins us back again, we'll go ahead and jump to that. Okay.
Sounds good.
This is, okay. We are now moving to two resolutions to review tonight. One of them is, we were just talking about this one. Bunny, I'm gonna have you jump up. Our first
Sarah,
resolution.
can I make a point of order?
Yes, Leah.
Just because we are, or sorry, Rachel, just because we're on the agenda, can I make a motion that we endorse the Highline School Levy? And if Long shows up, hear about that content later?
Okay, so you're making a motion. Do we have a second for this motion?
I'll second it. Ann Martin.
Okay, so Leah Griffin makes the motion to vote now for this levy, and Ann Martin has seconded. Let me go back to this. So we could do a voice vote again. That could be the simplest way to go about it.
You need to do speeches, Rachel.
Thank you, Carla. Okay. Leah, since you have made the motion, would you like to speak to this, or we don't have Long here, but would you like to speak in favor?
Yeah, I just wanted to make sure that we got to this important measure and make sure that we didn't miss it going through not having the speaker. But I'm happy to speak for a levy in Highline. I started my teaching career, student teaching at Highline High School in one of the most diverse school districts in the country, more languages spoken in the school district than I think any other district. And we know how important it is to have educational equity. And I know now teaching in North Seattle that students district to district don't have equal opportunity and equal funding. And I think it's especially important that in South King County districts like Highline, that we as Democrats stand strong for funding for schools and for students. And I would urge us to heartily endorse the Highline Educational Levy renewal.
Thank you, Leah. Do we have a speaker against the renewal of the Highline Educational Levy? Any speakers against? Okay, we have we have no speakers against. We could do the vote by acclamation as we did just previously. If everyone would unmute themselves, all those in favor of renewing the Highline Education Levy, say aye.
Aye.
All those opposed, say nay. Okay, we have a, by acclamation, a unanimous endorsement to renew this Highline Education Levy. And if Long comes, we'll break the good news and he can give us some information about it. So thank you for bringing that up, Leah. Thank you very much. Okay, now we are going to move to the resolutions. So our first resolution, which is supporting Whole Washington Health Trust, was brought to us by Dale Bright and member Jen Nye, who did our presentation just an hour ago. And a link to the resolution supporting Whole Washington Health Trust has been placed in the chat. Now Bunny Hatcher is going to take you through a summary.
Oh, thanks. First of all, this resolution has gone through our healthcare caucus, our endorsements and resolutions committee, and the executive board with recommendations of due pass. This resolution cites documents such as the United Nations Universal Declaration of Human Rights, our Declaration of Independence, our state and county and local party platforms, all supporting universal single-payer health care. It talks about stress the fact that health care is a basic human right and that an affordable universal single-payer system is the most equitable and effective way to do this. It also points out that this is a way to attain greater ethnic and economic equity in healthcare because it is people of color and the poor who are most likely to be uninsured or underinsured. I mentioned that the 2020 state platform calls for Washington to establish a single payer system. And whole Washington has crafted a bill, as mentioned earlier, that guarantees healthcare to all of us, and the funding mechanism was developed by an economist, reviewed by the Department of Revenue and Employment Securities, and it states that it would be cost effective and save billions. So it asks that it be it resolved that the 34th District Democrats endorse the whole Washington Universal Health Care Bill, and that it finally be resolved that our adoption of this resolution, that news of this be sent to the Seattle Times and all of our state representatives. And this was, now I'd like to, for a speaker for, I'd like to hand it off to Jen.
Great, Jen, thank you. Did you want to speak or are you making the motion?
Oh, I'm sorry. I have to make the motion, right?
Yes.
So I would like to make a motion that the 34th District Dems adopt this resolution supporting Whole Washington Health Trust on Senate Bill 5204.
Okay, thank you, Bunny. Bunny.
We need a second.
Yes.
A second.
Who is making the second?
I'll second. Richard.
I'll second.
Okay. All right. I think I heard Richard. Richard Bartlett.
Yep, that's me.
Thank you, Richard, for making the second. So would anyone like to speak against this motion?
Oh, no, we get a speaker for first.
Oh, I'm sorry. Oh, gotcha. Okay, who would like to speak in favor of this motion? We're going to have up to two in favor and two against.
Mm-hmm.
Can I
yes.
speak in favor?
And yes, go ahead.
Okay, so I reviewed the resolution earlier this afternoon again, and a few words just really stuck out for me. Happiness, liberty, security. And these are not features of our current system. My husband and I have health insurance. He was experiencing symptoms, went to the doctor who recommended an MRI, and the results came back that he likely has MS. And the way that we as Americans process a diagnosis like that is wildly different from the way the rest of the civilized world does. We have layers of stress and worry that just doesn't exist in places that have universal health care. MS is a lifelong disease. And so, we worry, how are we going to pay for medications or procedures? And how long do we have to work to make sure that we have insurance? And then to add insult to injury, while we're grappling with this news, we get a bill for the MRI, and it was $770 some. So I'm asking, what is the service that insurance provides what value do they bring to society? So it sometimes just feels like we're bending over backwards to retain this racist system when a solution exists. So I'm humbly asking everyone to please support this resolution.
Thank you, Jen. And Jen, I personally am just sending a whole bunch of love and good wishes to you and your husband. That is heartbreaking news, and I'm so sorry about that. And so this is now just giving me one more reason to have a personal incentive to make sure that this passes. Do we have a speaker against adopting this this resolution? Any speakers against? Seeing that we have no speakers against, I would be willing to call for a vote by acclamation, as we did on the others. Please unmute yourselves, and all those in favor of adopting this resolution supporting Whole Washington Health Trust, please say aye.
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 All those opposed say nay. Okay, by acclamation, we have adopted the resolution.
Moving on.
Thank you, everybody. Yes, thank you. Okay, our second resolution was brought to us by the Environment, Energy, and Land Use Caucus, co-led by Annie Phillips, who is here with us tonight. The resolution in support of a select committee for climate in the Seattle City Council has been placed in the chat. This resolution was linked from within emails from the last couple of weeks between Carla and you. And Bunny will take you through a summary now. Bunny, take it away. Bunny Hatcher, you unmute yourself.
Oh, yeah, okay. I want to give a shout out to Annie and Randy and the Environmental Energy and Land Use Caucus. Anything that gets through there and comes to me is always flawless. It has passed their caucus, it has passed the committee and the e-board, also with a do pass recommendation. The resolution cites Seattle's goal in reaching a greenhouse gas reduction and what will be needed to do that. That will require legislation that will involve at least 6 different county council committees that to establish a consistent citywide multi-sector method of doing this. It's recommended that as a committee of the whole, the Seattle City Council form a select committee for climate, which would track and hold the council accountable for achieving goals and highlight the ways that the committee could prioritize giving the city ways to meet its greenhouse gas reduction goals. So it asks that we resolve that the 34th Legislative District Democrats request the Seattle City Council immediately form a select committee on climate change and environmental justice. And that committee, to further resolve that committee will ensure agreement on priority strategies to achieve the city's greenhouse gas reduction goals, along with a detailed plan for monitoring its success.
Is that it, Bunny?
So that's it. So I would hand off to Annie because I'm sure that she can explain this much better than I can.
Okay, and Bunny, did you want to make?
Once again, I'll make a motion that we, I keep forgetting that little important.
No worries, no worries.
Yeah, so I would like to make a motion that we adopt this resolution in support of a select committee for climate in the Seattle City Council.
Okay, so Bunny
Second.
Hatcher has made the motion to pass the resolution in support of a select committee for climate in the Seattle City Council. Is there a second?
I second. It's Kathy Minch.
Kathy Minch. Okay, thank you, Kathy. Kathy Minch has seconded. And Bunny, did you want to cede your time to Annie to speak to the motion?
I sure do.
Great. Thank you. Annie, are you ready? I yield the floor to you. I'm going to unmute you. Annie, are you there? Are you ready?
Can you hear me?
Yes, we can hear you now. Go ahead.
Thank you. So I think Bunny did a really good job. And climate is the issue of the day, and it's becoming more and more urgent all the time, that we put all the effort and funding and energy that we can into taking bold and urgent action to limit our greenhouse gases and reduce them and follow the goals that Biden has set, which are really wonderful. And this resolution, we feel, will help us reach that. Seattle can be a leader in climate in the state and even in the nation. We have some wonderful momentum there, but we don't have coordination between the 6 different committees on the city council. And the select committee would provide the coordination, the cohesion between all these different efforts so that it will make a lot of sense and have more efficiency. So please vote yes.
Okay, thank you, Annie. Would anybody like to speak against this motion? Anybody like to speak against? Okay, well, hearing no speakers against, I would like to recommend that we do a acclamation voice vote. Everyone, please unmute yourself, and all those in favor of adopting this resolution, please say aye.
Aye. Aye.
All those opposed, please say nay. Okay, we have a unanimous yay vote to adopt the resolution in support of a select committee for climate in the Seattle City Council. Congratulations. Thanks again, Annie and Randy, for your fantastic work, tireless work on all of these things to work for a better climate. So PCO, we're going to move on to our wonderful chair of the PCO committee, Nick Bonazza, who is going to talk to us about how to prepare for the general election. And this election, even though it's not our general, it's not the midterms, it is still vitally important. We've got some really nail biter situations. So Nick, I'm going to pass the mic to you to tell us all about it.
Great. Thank you. Thanks a lot. I've just got a few announcements. We're, recognizing the low voter turnout that we had for the August primary, I've begun scheduling small focus groups with 3 to 4 PCOs across the 34th to meet in person at safe outdoor locations to talk about how to offset voter apathy, and as Rachel just mentioned, in a non-federal election year, and ways to encourage a culture of voting. These will happen in early evenings through the month of September and probably into early October also. I'm asking PCOs for insights specific to your neighborhoods. I'd like to talk about what you find effective, what works when you canvass. If you're interested, other PCOs that I have not contacted, if you are interested in participating in meetings or having insights like this to share with me, please contact me. By the way, walk packets, that are sample ballots for Burien, will be available on September 17th. Packets for the rest of the 34th on October 1st. As you canvass, please remind voters, it's been mentioned today at the very beginning of our meeting, remind voters to vote on every race, up and down the ballot, not just for names that they recognize. Every race counts. Washington State is not immune to attacks from the right. For example, the Tri-Cities are pushing back hard against Governor Inslee's mask mandate in schools. I don't think we have to remind ourselves about what's happening across the country with challenges to voting rights and women's rights to choose. The 34th has an aggressive schedule for canvassing opportunities in Burien, beginning Sunday, September 19th from 1 to 4 p.m. and every Saturday from the 25th, 10:30 to all the way from September 25th to October 30th, 10 a.m. to 1 p.m. every Saturday. Several candidates will participate along with union members. Our chair, Carla Rogers, has contacted several unions to work with us on these canvas events. And you could learn more about these opportunities on the website, and I'll be sending emails out to PCOs, and also check out our monthly newsletter. We need to have table volunteers to help sign in folks at these events. If you're interested, please let Carla Rogers know, or myself. You've got our information. Let us know. Burien is a focus with four positions on the city council, including Mayor Mata, and you know who the other endorsed candidates that we had. Several candidates also will participate at these canvas events in Burien. Mayor Mata and several candidates with an agenda that there's four candidates that do not represent democratic values or our Democratic Party values. Martin Barrett, one of the folks running against our endorsed candidate, Hugo Garcia, made an interesting quote the other day. Quote, "God is very interested in government." After referencing Matthew 28, verse 18 through 20, there's a DNA and there's a destiny for the city of Burien. There's a perfect alignment between Burien here on earth and God's idea up in heaven. You know, need I say more? By the way, this candidate outpolled Hugo Garcia in the primary by approximately close to 500 votes. So please, we need all the help that we can to get our endorsed candidates elected to the Burien City Council to do the hard work that the Burien City Council has been doing for the past 4 to 8 years. We will also have a West Seattle event on October 9th in partnership with Teresa Mosqueda Campaign for City Council. One final note, please remember COVID. If you're canvassing outdoors, step 6 feet away from that door, wear a mask. And if you don't want to do that, contact me. We could phone. We could set up a phone bank for you. So thank you. And remember our mission statement. It's our chief reason for being here. And thanks. That's all I've got. Everybody's got my information. And I'll be sending out emails to PCOs with more detail about the Canvas events all the way through October 30th. Thanks.
Thank you, Nick. It's our opportunity is huge and exciting. We've got some exciting plans for Burien. And once again, Carla and I are asking each and every one of you to please click the link in the chat and sign up for one or more of our upcoming canvases. We're going to have, as you can see on the slide, several opportunities, And if every single person just took one shift, it would make a huge difference. So call your friends, buddy up with somebody, bring folks with you, your family, your kids. It's a great opportunity to get out and meet your neighbors of the 34th in Burien and talk to them about how important this election is. It's really critical, folks, that we make voter contact. We just can't lose these seats. We cannot go backwards. I mean, the talking about God and putting that as a priority about how we run our elected positions is just wrong-headed as far as I can see. It's exactly what'll happen, though, if we don't step up and help. So look into our opponents, do some research. It will curl your toes, I think. You'll see and hear what's happening in other districts with conservative values that are sort of sneaking in there and taking control. And the conservative Burien slate of 4 candidates is running. If they win, it will change that community.
Rachel?
Yes.
You have a question from Annie, who actually lives in that area?
Annie, go ahead. Your question, please.
Thank you. I am really worried about who goes race. And I live where there was just this proliferation of signs for Martin Barrett, the guy that Nick was talking about. And that's a really scary idea, that somebody wants to bring God into Burien government. We've got to put a stop to that. And what I think we need is to get a yard sign in just lots of yards in this area, in the Burien area, especially where Martin Barrett was, which is out here on 3 Tree Point. So I have put my email address in the chat. If anybody wants a Who Go Yard sign, I will let him know and we'll get you one right away.
Great, thank you, Annie. So yeah, we're all, there's a lot of folks who know it firsthand, who live in Burien. This is our #1 mission. If you are wondering where you can make your footprint felt and your effects appreciated, Burien is the place to be. So finally, as we mentioned earlier, we have a special guest for you tonight. This is our special good of the order. Beth Farmer is Director of the Safety, Education, and Wellness Technical Unit of the International Rescue Committee. She's a licensed clinical social worker with 3 decades of experience working with people who have experienced complex trauma, including war, persecution, and torture. She partnered in the effort to develop the first validated mental health screening tool for refugees, the Refugee Health Screener 15, and helped develop the Center for Disease Control's domestic guidance on mental health care for refugees. Over the last 15 years, she has helped develop and lead numerous innovative health, mental health, and psychosocial well-being programs for refugees and asylum seekers. And in addition to her role at IRC, Beth is an adjunct faculty member at the University of Washington's Global Health Department. Everyone, let's please give our focus and our waving hands, clapping hands to Beth Farmer. Beth, are you there?
I am. Thanks so much. I'm not sure if you guys can see me, but I took myself off, put myself on camera. So can everybody hear me?
Yes. Yes.
Oh, excellent. Good, good.
Go ahead.
Okay, great. Thanks so much for having me here. I'm very much a proud West Seattle, not native, but I've been here about 30 years. So I'm pretty happy to be here. And I've known Carla for a really long time, since our children were in elementary school. So I appreciated her inviting me. I think I'll go ahead and share my screen. Oh, this will stop screen sharing. Do you want to continue?
Here, yeah, let me do that.
Okay. Is that okay?
Yes, now you can screen share.
Okay. I just have a short presentation, but I'm hoping that I can answer questions, yeah, to the extent that I can on the current situation in Afghanistan. So I'll go ahead and just dive in here. I wanted to first say a little bit about my organization, just in case people hadn't heard of the International Rescue Committee, but we're a humanitarian organization that's been around a really long time. We were founded in 1935. One of our founders was Albert Einstein. So we started off helping forcibly displaced people within Europe, and now we work in 40 different countries around the world in lots of different settings, and we have 25 offices in the US, soon to be 28 by the end of this calendar year. We've been working, Afghanistan has a place we've worked since 1988, I think the year before Russia left, but I'm not 100% sure. And we've had a lot of programs there, primarily focused on women and girls' health, gender-based violence, and women's empowerment. And we've been providing resettlement support in the US to Afghan SIVs since 2006. We have been the largest recipient of Afghan SIVs since 2006. So this issue is near and dear to IRC's heart. I wanted to take a moment just in case people didn't understand these different terms, because I'll be talking about them. But we have refugees, and refugees, in addition to having kind of a regular definition, it also has a legal status definition within immigration. And these are people that have fled their country, they have crossed a border, they've been recognized by the United Nations as refugees, and in response to a yearly presidential determination, there's some populations that can file and ask to come to the United States, and after a very lengthy processing, they can actually be received in the United States by a resettlement agency. And it's a very, very regulated flow of people with ceilings, not only ceilings nationally, but also ceilings on particular populations. And with it comes a very particular package of services that resettlement agencies provide, and a pathway to citizenship. People can get federal benefits, they can work when they come into the country, and they can adjust their status to a green card if they're so eligible in a year, and then to citizenship 5 years after they've been here. SIVs, also known as special immigrant visa holders, is a special designation that the US has had before, primarily to people after the Vietnam War, but most recently to people from Iraq and Afghanistan that worked for the US government, usually the military, not always the military, but usually the military. So since 2006, we have allowed people who have worked for the US government for a minimum of 24 months and who are currently in danger to file to come to the US along with their families for the SIV process. Up until currently, the only people who have come from Afghanistan have had to have an SIV anchor. So the primary applicant had to have worked for the US government. That has recently changed, and I can go into that. From Iraq, it was a mixed migration flow. It was SIVs as well as refugees, but from Afghanistan, 2006 on, only SIVs. Parolee is a different designation. Parolee is a temporary humanitarian designation, which the US can bestow for people, generally for up to 2 years. Parolees do not have access to any benefits. They can petition to work in the US, and generally it's granted. It takes a while, but generally it's granted. But they cannot access federal benefits. And then asylum seekers are people who are asking for refugee designation, but they ask from within the US, and then they go through a very long, extended legal process to see if they meet that definition. As I said, refugees are eligible to work and for federal benefits, so are SIVs. Parolees are not. They can petition, but they don't have any federal benefits. Asylum seekers are also not, but if they are determined to be asylees, then they can get, then they can work and get benefits like a refugee, because essentially they're refugees. So why do all of these matter? There was some talk that we were going to be taking refugees from Afghanistan once the presidential determination comes out this month, but that was kind of hijacked by the situation in Afghanistan and the mass evacuation. The initial part of that evacuation concerned trying to get SIVs out of the country and their families out of the country. So the first wave that went to Fort Lee in Virginia and were processed there. Those first military evacuations before the Taliban went into Kabul or Kabul was all SIVs. Now, it was always a long time. It always took a long time to get SIV processing done. But that whole processing system was essentially gutted under the last administration. And so virtually no one came as SIVs, I would say, for the last 3 years before the Trump administration. Very few that were eligible were processed and can come. So there was a massive, massive backlog, and the whole processing system, the refugee processing system, which is the same system for SIVs, was essentially gutted as well. And so when we pulled out of Afghanistan, that processing and ability to get SIVs through was really, really compromised. But after Kabul fell and the airport was essentially flooded, they didn't have the ability to check all of the papers for SIVs, and there were also a lot of people who were in peril. So for instance, the US over the last 20 years has set up a lot of programs like women's education programs, empowerment programs, girls' schools. They've encouraged women to run for positions. They've encouraged human rights and democracy advocacy. And all of those folks who receive money, kind of pass through dollars from US government entities like USAID, none of those people can apply for SIV. None of them, right? So this created a huge amount of vulnerable people that were coming to the airport. And there were SIVs and others who had their passports taken at checkpoints with the Taliban. And so there was just a lot of chaos at the airport. And essentially, they tried to get as many people out as they could. And now we have, I don't know, somewhere like 150,000 people that are being processed in second countries outside of Afghanistan, like Germany, Qatar, Albania, and Kosovo. I was talking to some folks in Albania and Kosovo today with processing, and in 8 military bases within the US. And IRC is one of the agencies that's working with the State Department and Department of Defense. And so that processing is really doing all of the background checks, the security checks, the paperwork, all of those things, the medical checks, you know, all of that sort of stuff to see if people will be allowed to come into the United States. And then once they are, they will be connected essentially to a resettlement agency for more support. Now, if they're an SIV, that support is pretty pretty set. We know the package that refugees get. We know the package that SIVs get. It's been in legislation for a really long time. The functions of how that works, the contracts, all of that is there. The problem is we're looking at somewhere between 50 and 75,000 parolees. And these parolees, after their process, won't qualify for SIV. And they don't qualify for the refugee status, because to get refugee status, that processing takes place overseas. So essentially, they'll be let into the US with this temporary parolee status and no access to benefits. They can petition for the US government for the right to work, but that could take 6 months or longer. And so there will be a large group of people, unless we have a legislative fix that can be in some significant peril and vulnerability. The question is, will they also have a path to adjustment of status and eventual permanent residence, or are they going to have to ask for asylum and then be in this backlog of asylum? Again, the asylum system has always been slow, always, but it was decimated under Trump. And now we have an immigration backlog of about 1.6 million cases. And the average time for an asylum case to be heard is about 5 years. So it's a significant amount of time to be in limbo and uncertainty. So I think I went over all of this. So, you know, people are wondering how they can support the current evacuation process. There are 3 resettlement agencies that are receiving refugees and parolees from Afghanistan. And those are the agency I work for, International Rescue Committee, World Relief, and Jewish Family Services. If you go to their websites, if you Google International Rescue Committee Seattle, they have a page on everything that they need for to help support evacuees. Carla, I think, sent around some opportunities for employment at bases for 2 weeks for volunteer groups or longer if people would like to go. So if you were thinking of volunteering as a group of 5 or more, you can get in touch with me and I can guide you through that process. Or if you're a single individual and think you might have, you know, 2 to 4 weeks to actually work on a base processing people, we do have emergency deployments where we are seeking people. It's not great pay, it's about $17 an hour, but it's very meaningful work because we are building it as we're flying it right now, I'll tell you that. And then the other thing is to advocate with your elected officials to really look for legislative fix for these parolees. Advocate for an expansion of resettlement for this next year so that the ceiling is higher so we can get people through the regular flow, which means that people who fled Afghanistan and are now in Pakistan and neighboring countries, that we can bring them through the regular flow, and also to help to continue the US's efforts to get US nationals and other targeted vulnerable people out of Afghanistan. So I will pause. That was a lot of information, and I will stop sharing. And I don't know if anybody, if that was informative, not informative, but I'm happy to answer any questions people may have. I think Chris has his hands up. And Art.
Yeah, I put a question in the chat for you.
Okay.
It was about does affirmative or defensive asylum come into play? And if so, how does it play out for those?
Yeah, that is such a great question. So affirmative cases of asylum essentially are people are invited or allowed within the US. And then they file for asylum. So they come here on some sort of visa, they have standing to be in the US, and then they ask not to go back to their country. Defensive cases are people essentially who turn themselves in at the border or cross at a border and ask for asylum. Those folks are put into deportation proceedings and then fight their case with an asylum case. Because all of these folks have been flown into the US and have humanitarian parole status. If they filed for asylum, it would be an affirmative, not defensive case, which puts them in a better position to get it.
Thank you. Elizabeth, we've got another question from Annie. Annie, would you like to ask a question?
Yes, please.
Go ahead.
Just wondering about their COVID vaccination status.
Yeah, they will be started at, vaccinations on basis, and they actually can't adjust their status or move forward in the humanitarian parole process unless they're fully vaccinated. So there is a mandate that they must get the vaccine, and they are tested, and if they're positive, they're quarantined there. The current vaccination rates in Afghanistan because of lack of vaccination is about 2%. So there's a lot of vaccination that needs to be happening. When they made the Pfizer was fully approved by the FDA, they actually have now mandated all refugees to get vaccinated to be able to adjust their status. That was not the case before that received full approval of the FDA, but it is the case now. And typically, all refugees are screened for almost all communicable diseases and have a battery of vaccinations that they must receive or they can't actually get their green card. So it's pretty strict on that. And then I think, Chris, you had your hand up and I don't want to overlook you.
I'm sorry, I need to put it down. Thank you.
Oh, okay.
But I do have another question from Art. Art, your hand is up. Go ahead and ask your question.
Yes, hi, and my question really is how does a community or someone in the community or an organization in the community go about inviting people to apply to live in their community? Is there a link or a contact with the government that one would send a letter saying we'd be happy to house or provide a home for a family?
Yeah, thanks so much, Art, for that question. When the U.S. first started receiving what were formally designated as refugees, the U.S. has always had refugees. I mean, the Pilgrims in many ways were refugees, right? Looking for religious freedom. But there wasn't that different class between immigrant and refugees, but that happened after the Second World War. And at that time, in the 40s and 50s and early 60s, communities did sponsor refugees. Churches got together, they sponsored refugees. They said, we will bring refugees here. That all changed after the Vietnam War, and they set up this more regulated process with resettlement agencies where they could monitor the services that they get. So we don't have community sponsorship anymore. Generally, resettlement agencies work with the State Department, their city, county, and state to look at how many people that community can absorb. And then the resettlement agencies will look for volunteers. And in the case of World Relief and JFS, Jewish Family Services, people to temporarily house new arrivals until they're able to find them a home. So both Jewish Family Services and World Relief have temporary housing options. I think all of them have options where people can mentor families, work alongside families. There's Airbnb programs as well if people have an extra rental where they can rent at low cost to families. So there's those opportunities there. But as of now, we don't have community sponsorship. That's something that we're looking into, and Canada still has that method. But the US doesn't. I will say the other thing, and this is kind of a big lift, but there are at least right now about 120 identified unaccompanied children that ended up on those planes. There may be more. They're currently in federal shelters, Office of Refugee Resettlement shelters, because those shelters, they do a really good job of family tracing. And so they're working that process right now. They keep people, you know, safe and supported while they see if they can connect them and release them to family members who then can support them in the United States. I have heard that the family tracing is not going all that well, and there's a lot of people whose families are still stuck in Afghanistan, that they're unlikely to be reunited with them. So it is likely that they will go into the unaccompanied refugee minor program, which asks for foster homes for these children. And Lutheran Community Services has an unaccompanied refugee minor program locally. And typically these tend to be teens because, you know, you don't generally run off to the airport if you're a 5-year-old without a parent. But if you're 15, you know, or sometimes when families are very poor, you might have a 15 or a 16-year-old that's already on their own. So that is a way to invite people into the community, is to sign up as well to be a foster parent. And typically it's not little kids. Typically it's generally that age, I would say between 15 and 18. And then people are on their own. They've got great services.
So would there be anybody at the county level or the state level then that would be dealing with refugees?
So Art, sorry, we have a couple other people with questions. So if you could, Elizabeth, I don't know if you want to give your contact information, but I would certainly.
Yeah, I can stay on afterwards too for other questions.
Okay,
well.
that's great. Let me just have Anne, because Anne's had her hand up for a long time. Go ahead, Anne, and ask your question.
Yeah, actually, I think some of my question was answered in the discussion from Art, but it seems like families do create a complexity that isn't necessarily covered by the refugee, SIV, parolee, and asylum categories. What in particular is happening for families that are coming in?
Yeah, so the person who is designated as the refugee, asylee, SIV, parolee, they can bring their spouse and their children unmarried up to age 30 or 23, not 33, 23, as part of their family. So there's the anchor, and then there's the members of their family. So they will come as families more than.
And so how are they treated though? Are they put into categories as well, or do they just have?
They get their status as a derivative from their anchor. So when their anchor adjusts, right, when their parents adjust, they can then apply to get citizenship. They don't have to all. So like if an asylum seeker gets asylee status, then their children, they apply to get asylum status, but it's granted. They don't have to go through the legal process. Their status it's not automatically adjusted, but there's an application for adjustment that happens. And it's granted always.
Thank you. It sounds like it's pretty complex.
Oh yeah, it is. It is complex, but just to say, generally, more than half of the people who come are children under the age of 18, and they come with a refugee parent or SIV parent. They get to bring their families with them.
Elizabeth, would you be willing to stick around for a little while? I would be happy to keep the Zoom open. We do have another good of the order, so I want to make sure we get to them. But thank you so much for sticking around. And if anyone has questions for Elizabeth, if they can just hang on, and we can go for a few minutes after 9. We have an announcement from Doreen Carroll. I apologize if I'm mispronouncing your name. Doreen, are you still with us? Doreen. Oh. Okay, Doreen is not with us I'm just looking over the list. So, Dawn, did you have something for good of the order? I know you have it in the chat, but go ahead and just share it with us all.
Absolutely. If you happen to know young people ages 23 to 26 that were in foster care as teenagers, they may be eligible for $1,000 in federal pandemic relief that they can use for any kind of basic needs, housing, food, transportation, childcare, education, employment, and much more. The deadline to apply is approaching very quickly. We have found only 450 of 2,800 potentially eligible young people at this point. And so we are asking for everyone's help to please spread the word. And I put the link there in the chat of how to apply. It's Treehouse that is partnering with the Department of Children, Youth, and Families to provide this support.
Thank you, Dawn. Yes, here, says our four-legged friends. Does anyone else have any good of the order items that they would like to share?
Madam Chair, I do.
Great, Chris, go ahead.
In this district's effort to become an anti-racist party and district, one of the things to put on the table is how we go about the spirit of our endorsements. We have seen across LDs in this county, and to include the 34th, issues arise in how endorsements are carried out, and specifically language used, what is perceived against candidates of color. One of the things I'm working on at the state level is looking at a pathway to endorsements that have an equity lens, because the rules that we use have been pretty much long-standing rules crafted by folks long before us that don't necessarily reflect the current makeup of the district. So that's something that you'll hear more about, and I will be working with, and it'll be something to put on our plates. And if we're serious about this, we will think about embracing it and rethinking how we go about the process of endorsements, keeping in mind that we have a stronger threshold for endorsement than it takes for the candidate to win the race. Thank you.
Thank you, Chris. That's great. Please do keep us informed on how we can stay very connected and updated on that. I definitely want to follow up on that. Does anyone else have any good of the order items? Any other good of the order items? Okay, what I'm going to do now is I'm going to adjourn the meeting. And Elizabeth will stay. If you would like to stay, feel free, but we're going to officially adjourn the meeting. Does anyone have the ultimate motion?
I second your motion.
Okay, I make the motion. Art seconds. The meeting is adjourned. Thank you, everybody, for coming, and we will see you next month on October 13th.
Thank you, Carla. I mean, thank
Rachel.
Thank you, Rachel, for stepping in for Carla.
You are very, very welcome, and thanks everyone for being here. Your presence makes the meeting succeed. So thank you. Bye.
Bye.
Night.
Good night.
Good night.
Good night. Good night, everybody. If that was, sorry, I'm not sure who's saying good night, but I wish you all a good night. And I'm assuming that those who are staying would like to continue conversation with Elizabeth. I will be happy to moderate with hands and questions up, or do we just want to shout out? So Art, go ahead and since you were in mid discussion of a multi-pronged question, go ahead and say what you wanted to say.
Well, thanks. Thank you, Elizabeth. I just wanted to follow up and to ask, is there a process by which one can, either through the county or through the state, that there's some official line of inquiry about being able to sponsor refugees of whatever their status is?
We don't have sponsorship anymore.
Right, I got
that.
But...
Yeah, so there isn't, I know that there have been a number of resettlement agencies that have been working with the federal government to allow some pilot projects to look at community sponsorship, but almost all refugee flows happen at the federal level, not at the local level. Now, the city and county sometimes will provide budgetary support for services that support refugees and immigrants and other vulnerable populations, but that probably the city, county, and state level is not going to be your avenue for that. I think, working with the resettlement agency about what they need to welcome and support refugees is probably the best way forward. Whenever they do a determination, as I said, on how much a city or county, how many refugees they can take, resettlement agencies must demonstrate the willingness of the community to help provide a welcoming environment. And that includes the number of people who volunteer to mentor and support, to tutor children, to provide temporary housing for the first 2 weeks that people get here. So I think that's probably as close to sponsorship as we have right now.
Okay, thank you very much.
Sure.
Any other questions that folks might have? I just was going to piggyback on what Art, on your answer to Art about, you said tutoring and things like that. Is that actively something that's going on? Is it like teaching English, or I don't know what the folks are, where they are in their, what they know and how their education levels are?
Yeah, that's a really good question. Almost all of the resettlement agencies not only will have English as second language classes, but they also actively provide after school support for children and English language tutoring, and they're always looking for volunteers for that. People coming in will have a wide variety of English language skills. Typically, most SIVs from Afghanistan and Iraq are the anchor, which is mostly men, is fluent in at least English and Dari, if not multiple languages. But generally they're quite young, you know, as most of our military are. They are embedded with the military. They go out on very dangerous missions, often serve as interpreters. And they often have wives that have a number of young children and typically don't have those English skills. And so, you know, there's a wide variety of volunteer options that people can have depending on what they want to do. It can be one-off things like having their book club do a hygiene supply drive so they can have hygiene kits for when people come into the US, or cleaning kits for their new homes, or providing a meal when people get to their first apartment after they get from the airport, a culturally appropriate meal, or setting up the first apartment. Most of the stuff is donated so that it doesn't eat into any money that people may have. And so there can be these one-off things, or there can be longer term things like providing tutoring for a week, or there's other skills, you know, that if people have professional skills. I know Jewish Family Services has mentoring programs where they may have people that were engineers in their home country that want to learn how they could get recertified or be an engineer in the US. And so I would really encourage people, if they go to the resettlement agency's local website, IRC, World Relief, Jewish Family Services, they're going to have a really big list of not only volunteer opportunities, but things that they need.
Thank you. That's great.
Yeah. Other questions?
Any other questions or just thoughts or things you're wondering about?
I have a question.
Yes, go ahead, Norman.
Oh, what's it, Carl? Oh, how many SIV applicants are still in Afghanistan? Did you mention that?
Oh, I didn't, but it's a lot. I don't know the exact number. It's a lot. You're still in Iraq, to be honest. I mean, this isn't, yeah, I mean, when we pulled out of Iraq, it wasn't the mass number of people coming to the airport, because we left about 3,500 ground troops there, and there was more sectarian violence than a more cohesive threat like the Taliban. But yeah, we still have SIVs we haven't processed from Iraq. The sectarian violence has died down, so they're less in danger than they were, you know, 5 years ago. But it is, yeah, it's a lot. And I would also say a large percentage of IRC staff, because they have been one of the agencies that has most resettled SIVs, probably 10 to 15% of our staff are from Afghanistan. And I don't know of any of our staff, and we're having weekly phone calls with them, that have been able to get their family out, and all their family is targeted because they're SIVs, because they worked for the US government. So there's the dual thing of they're not SIVs themselves, they're not eligible, but because of the person who is in the United States, they're now targeted. And to be honest, we don't have all of our staff out either, even some of our US national staff. So there's a lot of people that are stuck. Yeah, and that can't cross a border either. That's generally what will happen, is people will try to cross a border, but Pakistan's closed its border, which is mostly where people cross. So there's limited options right now as they stand. And I think everybody's waiting to see what's going to happen. Like our teams there we've negotiated, not negotiated in that we've made concessions, but we've had agreements with the Taliban before to allow us to do some level of operations. And, you know, I don't know what that's going to look like. So far, people haven't harassed or threatened the staff there, but I would say everything's kind of on pins and needles of what this is going to look like over the long term. And I don't think people have a lot of trust that it's gonna, that people will be allowed to get off unscathed. So, yeah, there's a lot of worry and fear and a tremendous amount of just desperation and pain from many people that are SIVs in the US that can't get their families out either, and SIVs in Afghanistan that can't get out. So,
Colleen, did you have a question?
Yeah, I just wondered when you were talking about the volunteer opportunities earlier, along with the paid positions, is that also to work on military bases, or?
Yeah, so we were asked a couple of weeks before the evacuation started, along with Catholic Refugee and Immigrant Services, to work with the State Department and the US military to process SIVs, because we do a lot of processing for refugees overseas. We've already worked, and so does Catholic, already worked with the State Department, and we know how the processing and vetting goes. We don't do the investigation, but we know how it goes, right? Mm-hmm. So we were in Fort Lee working on that with SIVs, and then things just kind of exploded. Mm-hmm. And it's morphed from there. And now we are on 8 bases, and a lot of our staff, both internationally and in the US, have been deployed to these bases to try to process folks. And it's still not enough, because we can't deploy all of our staff from our offices, because mm-hmm. people are leaving the bases to go to the offices. Wow. So we have emergency deployment positions on the IRC website. They're not glamorous jobs. They're things mm-hmm. like greeting buses and mm-hmm. you know, helping people know where the food tent is, and doing essentially kind of grunt work, right?
Right.
But there's a lot of people and they need a lot of help. Mm-hmm. And then we're also just started looking for volunteer groups that might want to do a 2-week deployment. So let's say School of Social Work that wants to send its MSW students a group for 2 weeks, or a group like your group that might have a group that would be willing to go to a base for 2 weeks. Mm-hmm. And that's a little bit of a different process than employment, because it's volunteer. But we've started that as well. We don't know how long we're going to be at bases. I think that we were estimating, the last I saw was, if just from the processing side, if we spend 1 hour per capita on the forms to process, it's going to take us about somewhere between 100 and 150 days to get through. So I think we're going to be on the base, and also we can't release people from the base until they've been completely cleared. Mm-hmm. The medical part's the easiest part. It's the security vetting, right? Mm-hmm. That takes a long time. So I think people are going to be on bases, not in these mass numbers, but I think they're going to be on bases for probably through the end of the calendar year, is my guess. Mm-hmm. And I don't know of a process in place if people don't pass the security vetting. I know we're negotiating with other countries to possibly receive them, but they won't be allowed to continue on in the US. So
wow, man. Okay, thank you.
Yeah, it's complex.
Yeah.
And as you can tell, I'm always the life of the dinner party.
Oh, gosh.
Other
Anybody else? Questions from anybody? Thoughts? Well, I don't want to hold you too long, Elizabeth, because you stayed way past your the time that we said you would be here. So we really, really appreciate.
I appreciate
your
y'all's
time.
interest.
Yeah, thank you so much. That was
Appreciate y'all's
really
interest.
informative.
Yeah, if you have any links that you could send us, or I don't know if you know any links off the top of your head that you could put in the chat, but I would be happy to post those. We've got a Facebook page, we have a website, and we can post these links, because I'm sure that folks who either didn't get to come to the meeting or that left early or didn't get to see your presentation, that this could really be valuable, and we would love to have our members stay engaged and answer the calls to action, because it's just really incredibly important. This is such a tragedy.
Yeah, I think people are feeling really, really helpless and wanting to help in some way for these poor people that are in this situation through no fault of their own. So, yeah.
Well, thank you. I will get to Carl